a little bit of an introduction about IIH and body weight and why am I talking about this today. So IIH, as probably all of you know, even better than me, it's a condition of an unknown etiology that primarily affects reproductive age women. It causes increased intracranial pressure, headaches, and vision problems. But I am talking about this today precisely because over 75% of patients with IIH have obesity or overweight, specifically obesity. So obesity is very prevalent among people with IIH. A higher body mass index or a higher BMI, and also weight gain of around 6% of body weight gain increases the risk of IIH and also the risk of complications related to IIH. Unfortunately, the exact mechanism linking obesity to IIH is still pretty much unknown. Unfortunately, there's some hypotheses out there, but there's nothing very clear yet. And weight loss is an effective treatment for IIH. However, I think it's really important to mention here that nowadays in the realm of weight loss, we don't use weight loss as we used to use it years ago, where we try to make people with obesity or overweight go back to their normal BMI. We are not trying to make people with obesity go back to a normal BMI. We're just trying to produce some weight loss that can be effective for treatment. Usually that weight loss ranges between 5 to 10 to 15%. So we don't need to make people lose a ton of weight to go back to their normal BMI. With just around 10% weight loss, so 10% of their initial body weight, we still can see effective and improvements in IIH and all other conditions that are linked to obesity as well. We also see this.